Hello everyone, welcome to Dentitionary. We are back with our physiology lectures. And our topic for today's lecture is thyroid hormones. You guys can ask your doubts in the comment section. We also provided the PDFs of these slides. So, without wasting much time, let us begin. First comes the introduction. Thyroid is an endocrine gland that is situated at the root of the neck on either side of the trachea. It has two main lobes, which are connected in the middle by an isthmus. Please note this line. Next is it weighs about 20 to 40 gram in adults, and in female it is larger than in males. These are some basic introductory lines regarding your thyroid gland. Next are the hormones secreted by thyroid gland. There are basically three main hormones, namely the T3 or tryptophan, T4 means tetrodotoxin, and calcitonin. This T4 or tetrodotoxin is also known as thyroxine, and it forms nearly 90% of the total secretion, whereas the T3 or the tryptophan hormones is about 9 to 10%. Next, we have the potential and duration of the actions of these thyroid hormones. The potential of T3, that means the tryptophan, is 4 times more than that of tetrodotoxin, or what is the other name of tetrodotoxin? It's the thyroxine. This tetrodotoxin acts for a longer period than T3. Duration of T4 action is 4 times more than the T3 actions. This is because of the difference in the affinity of these hormones to the plasma. This T3 hormone acts on the target cell immediately and T4 acts slowly. These points can be written as difference between T3 and T4, right? Next comes the half-life. Thyroid hormones have longer half-life. The T3 has longer half-life of 7 days, whereas T3 is of 10 to 24 hours. Metabolism, its main metabolism takes place in three main parts, namely the liver, muscles, and kidney, right? Next comes the most important part, that is the synthesis of thyroid hormones. We have the three main parts, plasma, follicular cells, and thyroglobulin. This iodide present in the plasma converts into iodine by oxidation with the help of peroxidase enzyme. This iodine causes iodination with the help of iodinase enzyme and convert tyrosine into monotyrosine and tyrosine. Let me repeat it. Iodide converts into iodine, which helps in conversion of tyrosine into mono and diiodotyrosine. Now, when this monoiodotyrosine, that is MIT, reacts with diiodotyrosine, MIT plus DIT gives you mono plus tri, T3. Hope this is clear to you. Now, when two DIT reacts, they form tetra. Correct? Tetraiodothyronine. Now, this tri and tetraiodothyronine get released to the plasma in the form of T3 and T4. Hope so the synthesis is clear to you all. Mark this as important. Next, we have the functions of thyroid hormone. Okay, let me remind you all, thyroid hormone comes mostly as a long note in your professional as well as in terminals. So please learn this answer by heart. Getting back to the topic, we have the functions of thyroid hormone. The major function is on BMR. Actions on BMR or the basal metabolic rate, on protein metabolism, on carbohydrate, fat metabolism, next on the body temperature and the body weight. Thyroxine increases the metabolic activities in most of the body tissues, except in brain, retina, and some other parts. It increases the BMR by increasing the oxygen consumption of the tissues, right? If the thyroid hormone concentration increases, BMR increases. Clear? When it comes to the protein metabolism, it is directly proportional with the thyroid hormone. Let me write it clearly for you. Okay, so thyroid hormone is directly proportional to BMR. Next, it is directly proportional to protein metabolism. Correct? Next, it decreases the fat storage by mobilizing it from adipose tissue and fat deposits. Thus, thyroxine increases the free fatty acid level in the blood. Next on plasma and liver fats, on vitamin metabolism, on body temperature. Obviously, if it increases the BMI, it will definitely increase the body temperature of the body. And finally, the body weight. Coming on to our next part, that is the regulation and secretion of thyroid hormones. There's a small chart given in your textbook from which it is derived. Low BMR causes leptin, alpha melanocyte stimulating hormones. This will cause the stimulation of the hypothalamus. So these hormones will cause stimulation and these hormones will cause inhibition. Please mark this. Stimulation and inhibition of hypothalamus, which will lead to release in thyrotropin releasing hormone, stimulates the anti-pituitary, releases the thyroid stimulating hormone, moving to thyroid gland, and finally release of the thyroid hormones. Again, these hormones stimulate the hypothalamus and these hormones inhibit hypothalamus, causes release of thyrotropin releasing hormone, which enters into the anti-pituitary, causes stimulation of thyroid stimulating hormone, moving to thyroid gland, and finally releasing the thyroid hormones. What are the thyroid hormones? T3, T4. There's one more thyroid hormone named calcitonin. Correct? Moving on to our applied physiology. Hypersecretion of thyroid hormones leads to hyperthyroidism, whereas hyposecretion of thyroid hormones leads to hypothyroidism. The name itself suggests hyperthyroidism means hypersecretion, and hypothyroidism means hyposecretion. Hyperthyroidism causes Graves' disease and thyroid adenoma, whereas hypothyroidism causes myxedema. Graves' disease is one of the most frequently asked with short clause. Same for myxedema. Okay. Let us have a short discussion on Graves' disease. Graves' disease, we all know, is an autoimmune disorder and it is the most common cause of hyperthyroidism. Normally, the TSH or the thyroid stimulating hormone combines with the surface receptors of the thyroid cells and causes the synthesis and secretion of this thyroid. In Graves' disease, the B lymphocytes produce autoimmune antibodies called thyroid stimulating autoantibodies. These antibodies act like TSH by binding with the membrane receptors of TSH and activating the CMP system of the thyroid follicular cells. This results in its hypersecretion. This is a short mechanism of thyroid hormone hypersecretion leading to Graves' disease. What are the signs and symptoms of hyperthyroidism? The signs and symptoms include, firstly, the intolerance to heat, obviously as the body temperature increases a lot, leading to increase in BMR. Next, increased sweating due to vasodilation, obviously. Decrease in body weight due to fat metabolism, diarrhea due to increased motility, and muscular weakness. These are some basic signs and symptoms of hyperthyroidism. Moving on to hypothyroidism. Hypothyroidism, the major or the main disease in hypothyroidism is myxedema. What is myxedema? It is the hypothyroidism in adults characterized by generalized swelling due to fluid accumulation appearance. So what are the main causes? It occurs due to decrease in thyroid gland secretion or iron deficiency. In addition, it's also caused by deficiency of thyroid stimulating hormones or thyrotropin releasing. Clear? Its major signs and symptoms include swelling face, bagginess under eyes, and atherosclerosis. So, while writing the applied physiology or while writing about hyperthyroidism and hypothyroidism, you should mention its introductory part, its mechanism, causes, and finally the symptoms and signs. Let me write it. Number one, the intro. Number two, cause. Number three, signs and symptoms. Clear? So these are some symptoms in Graves' disease. This is a case of goiter. Okay, so goiter means simply the enlargement of thyroid gland. It occurs with, both in hypo and hyperthyroid. Okay. Okay, so moving into the next slide. So that's the end of today's lecture in thyroid hormones and thyroid gland. This is it for your endocrine system. On the next slide, we will start special senses, and I'll also try to provide you the importance of human physiology part 2 as we did in part 1. So keep studying and keep showing your love and support towards Dentistionary. Thank you.